This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Onset of the summer season. Most people are gearing towards lots of outdoor activities with family members and friends. But along with the excitement and the fun come the dangers and risks involved in the warmest time of the year. The main culprit would have to be excessive exposure to the sun.
Some of the common summer diseases are sunburns, skin problems, stomach ailments such as diarrhea, sore eyes, dog bites, and flu. Usually mostly due to the hot, humid weather during summer.
Too much sun exposure can lead to heat exhaustion and cramps and heat stroke. Another hazard is direct contact with more people in airports, beaches, and other public places.
Para doon sa mga madalas na mag-out of town during summer, so dapat maging handa tayo sa mga dadalhin natin. Magdala ng sunblock na ilalagay 30 minutes before lumabas to do your outdoor activities. Drink lots of fluids.
If you're not careful, you might easily get infected with colds and cough because of the erratic weather patterns. How can you better protect yourself against these summer diseases? What are some possible home remedies? All these and more tonight on MedTalk.
Joining us tonight is Dr. Maria Victoria Pilares-Cruz, a national board member of the Philippine Academy of Family Physicians and a family medicine specialist from the University of Santo Tomas Hospital. Also with us is Dr. Eva Irene Maglonzo, the Executive Secretary of the Philippine Academy of Family Physicians and a medical specialist from the Philippine General Hospital and the University of Santo Tomas Hospital. You may join our discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening.
Summer is here and the heat is on.
Yes.
It's so hot these days,
Yeah.
and just like the BTR said, it brings about skin problems,
Yes.
digestive problems, and different types of virus that we can get during the summer. But first, let's talk about summer skin problems, the most common summer skin problems. Let's start off with sunburn. So please tell us what exactly is sunburn.
Well,
Dr.
it's
Cruz.
an acute inflammatory reaction due to exposure to the sun. But people can also get sunburn, although in the Philippines we don't have tanning salons, so it's mostly due to direct effect of the sunlight. Mm-hmm. So this can cause erythema, this can cause redness of the skin. Sometimes there's also associated itching. So we need to really protect our body against sunburn because it also depends on the UV light, UV radiation. There are three types, the A, B, and the C. So the A and B are the most harmful to our skin because they are the ones that penetrate the atmosphere, while the UVC is filtered by the ozone layer. Mm-hmm. So that's why you would see that in sunblocks or sun protection lotions, this usually refers to UVA and UVB protection.
And we talk about the protection, we talk about the sun. Do you think, in your medical expertise, the summer here in the Philippines every year, it gets hotter, it gets more humid, it gets drier? What do you think of this? Dr.
Yes,
Maglonzo.
it changes because of the climate change. Originally, summer is usually April, but March, sometimes there's already hot weather. When the Holy Week starts,
Yes.
usually it feels hot.
Yes.
So those are some of the changes. But unfortunately also, there were also some rain during that season. So the change in weather, like it will rain, then it will become hot. So that will cause some of the different summer diseases also.
And going back to sunburn, you mentioned the AB and UVC. Is there a particular time of day that we need our sun protection the most? And there are times during the day, even when we're under the sun, that we can skip sun protection? Is that correct?
Well, they say that you need to really avoid the sun between 10 a.m. and 4 p.m. But if you need to really go out into the sun during that time, then you have to wear sun protection. It's quite fortunate for us Filipinos, since we are medium to dark skin, that we have already a lot of melanin to protect us from the from immediate sunburn. No? But for those who are fair skinned, they easily sunburn. But for those who are darker skinned, they easily tan naman. So it's more advisable that you use a higher protection for those who are fair skinned, like SPF 30 and above, while if you have a more medium or darker skin, you can use at least not less than an SPF 15.
So SPF 30 and above for fair skinned, and 15 for those who are already naturally tanned, so to speak. How often should we apply our sunblock?
So you should apply 30 minutes before going out or before exposure to the sun. Then you have to reapply, because the others, they just do it once. You should reapply every 2 hours.
So if you do it once, you're more prone to sunburn? Is that correct?
Yes, you can still get the sunburn if you don't reapply.
And the sunburn, a quick description of what it looks like, and the feeling, or that one is already sunburned. Because sometimes hindi mo na napapansin that you're already burned by the sun because you enjoy the sun that much. And you want to achieve a certain color, but little do you know, nasusunog ka na pala ng araw. So
yes, it doesn't appear, the redness doesn't appear right away, usually after 2 to 4 hours. So if you are sunbathing, then you don't notice the effects, but when you get out of the sun, 2 to 4 hours, then that's the time you see the erythema, and it could be a little painful also. Because of the burn of the skin. So you really have to stay away from the sun, get as much protection, wear the proper clothing to protect you against sun exposure.
And what's first aid? What is your first aid? Let's say you're out at the beach, you're traveling somewhere, and you have no access to go to your doctor. What is the first aid remedy that you can do for sunburn?
You can place cooling ointments like zinc oxide. It's easily available in drugstores. Then, of course, you have to drink so that you prevent the complications.
How about a cucumber? Just cooling, something cooling.
Yeah,
I mean, which is readily accessible if you're at the beach and you
it
have
has
no...
cooling effect, but as far as these things are concerned, we don't have scientific studies.
Okay, so when it comes to sunburn, prevention, wear your SPF. If you do get a burn, then and address it just as Dr. Maglonso has mentioned. Now we move on to jellyfish and sea urchin. We like to wade in the water. We like to enjoy the water at the beach. But little do we know that, there might be jellyfish or sea urchin that we don't notice. So what are the signs that you have already been bitten, and how do you remedy this skin problem?
Usually there's a stinging sensation that is experienced by after the sting of the jellyfish, or in cases of sea urchin because of the spines. So it's parang puncture wound, no? So if you step on a sea urchin, so like for jellyfish, there are some poisonous jellyfishes, although I'm not a marine biologist.
But based on your experience when they come to you.
Yes. Well, it's really hard to determine whether it's poisonous or non-poisonous, but from the point of view of the doctor, you really need to manage the patient right away, like if there is some hypersensitivity reaction, because the skin reaction may not be just a local skin reaction. The patient may also go into an anaphylactic reaction or hypersensitivity reaction due to the toxins produced by the jellyfish. So you have to check also the airway, the breathing, and make sure that the patient is brought to the emergency room right away.
And in relation to that, first aid that has been actually administered to me when I was bitten before was suka.
Yeah,
Suka,
that's the most
and
common.
sometimes it's urine, but urine hasn't been.
No studies also.
But what is it about the vinegar? Before we got to the break, what is it
They
about
say
the vinegar?
it's the acidity, but that's the more common. But of course, we don't have studies on that. But the important thing is like we have to address the first aid that could be given. Like if it's bleeding, we can actually tie it with a piece of cloth. Then the important thing is we can give antihistamines if you have one, but the tablet will not work right away. So as mentioned earlier by Dr. Cruz, we really have to bring the patient to the nearest hospital so that an injectable antihistamine can be given.
Okay, so
and
this
then
is-
the other things like injection for tetanus, because there can be other poisonous materials also.
So this shouldn't be left alone.
Yeah.
When you're bitten or if it's already stung by a jellyfish, then you should bring that person to the doctor right away.
Yes.
Doctors will talk more about skin conditions during the summer. We'll talk about heat stroke and exhaustion, all that and more when MedTalk returns.
According to the Philippine Atmospheric, Geophysical, and Astronomical Services Administration, or PAG-ASA, the hottest temperature recorded in Metro Manila was 38.5 degrees Celsius, recorded on May 14, 1987.
We're back here on MedTalk. Now it's time to talk about summer safety. Doctors, summer safety when it comes to heat stroke and heat exhaustion. Let's first talk about heat stroke. What exactly is a heat stroke and how does one suffer from a heat stroke? Dr. Cruz.
Oh, okay. So actually, these are different degrees. The worst degree is the heat stroke, where the patient can really present with confusion, delirium. The temperature would be about 40 degrees centigrade, and the patient may not be sweating. Okay, so the patient will also have warm skin or red skin. So, and the patient will be more toxic, no? And therefore, this means that the patient is really dehydrated. Heat exhaustion is a less severe type of heat stress, no? So the patient may also present with dizziness, nausea, vomiting. Again, this is addressed by adequate hydration and putting the patient in a cool place. But for heat stroke, this is actually a medical emergency. So you should really differentiate heat stroke from heat exhaustion. Because the patient needs to be brought for emergency treatment, for hydration, and to immediately bring down the temperature.
What happens to the individual? What happens inside the individual when one has, you've mentioned the heat stroke, there's vomiting, and you don't need to sweat for you to be diagnosed that you're already having a heat stroke. But how does this happen? And what are the factors that lead to one having a heat stroke?
Usually, it's the extreme temperatures. A temperature of 40 degrees and above can lead to this heat stroke.
How do we
then
know
also
that
the dehydration also.
How do we know that that's the temperature when we're out in the sun? It's a sign of dehydration, and you're wanting to drink a lot of water, a sign that you're already dehydrated, that it may lead to a heat stroke?
There are
correct?
signs of dehydration, like usually you can look at the lips. No? So if it's so dry, you can look at the tongue also, or you can look at the lids. No? So usually they are sunken already. And of course the skin, if it's very dry also, those are things that they can look out for.
And first aid for heat stroke, you've mentioned to bring them right away to the nearest clinic or hospital?
Sometimes you need to immerse the patient to cold water just to bring the temperature down immediately. And of course, give them ibufluids to replace whatever losses they've had.
And heat exhaustion, same? Just a lot
You
of
can get a
fluids?
towel, with, which is something cold, then compress it on the different parts of the body. Usually, the applicable areas will be the armpits, the back, and the groin, where you can easily place this cold compress.
Okay, so
Because most of the nerves are there, which needs to be addressed.
okay, so when the patient has been revived with this method,
Bring to the hospital.
Hospital right away, hindi ba pwedeng kasi na-revive na siya or he's
so,
okay
so that the doctor can assess what else to do.
Okay, so hindi pwedeng porket you're okay already, you can continue on enjoying the beach and the sun. You really have to
Especially
seek
kasi
medical
if
attention.
you don't know how to take the vital signs, you don't know the blood pressure of the patient, so somebody must be able to do that for them.
Okay.
And you have to be more careful for specific groups of patients, like the very young, like children, and the very old, because they are more prone to severe dehydration, and especially if they have other comorbid conditions like they're diabetic, hypertensive, so you can expect more complications for those types of patients.
For mothers, for those who are traveling, what would you suggest they pack inside their bags when it comes to taking care of the older ones and the younger kids? What is a must? What is one item if you were to pack one item in your bag? Sige, one or three?
It's not
Three.
only one
One lang
item.
hindi pwede, di ba? O sige.
There's a lot.
Hand towel. A hand towel. No, maybe 3 items. Kasi you mentioned, no, you have to be careful talaga when it comes to all these summer concerns. So 3 items. Let's say 3 items, doctor.
Maybe a spritzer. If you have you can buy that in the
Yes.
grocery, fill it up with water or cold water, then spritz yourself.
Okay.
Maybe that can help you cool you down.
Any?
Then you can also bring water, no? If the place that you will be going to, the water is not safe to drink, so you need to hydrate, so you need water.
Kasi, you're all excited to go on the trip and you don't anticipate these things and you pray that nothing like what we've mentioned happens rather.
Yes.
We've talked about heat stroke and exhaustion. I'd like to talk a little bit about, go back to the skin concerns. Getting a henna tattoo at the beach during summer is very popular, is very common. But it can also pose as a hazard, if I may say, because of the ink that they use when the tattoo is given. What do we do when we have an allergic reaction to the henna tattoo?
Well, it's advisable that if you really have a strong history of allergy, to stay away from those tattoos because you can't really tell if you're going to react to the dye. But if you do, siguro that's one thing that you have to bring is an antihistamine. If you have a history of allergy, most probably these patients already are taking some form of antihistamine for their allergy, so they should have a ready baon of their antihistamine just in case that they can't refuse having the tattoo.
So we have our spritzer and an antihistamine. We just named 2. During the course of the discussion, I'm sure we're going to come up with 3 or more.
Yeah.
Now we go to viral diseases or infections that are more common during the summer. Let's start off with sore eyes. A lot of kids, as well as adults, get sore eyes during the summer. How does this happen? Why does this happen? And what are the factors that lead to one getting sore eyes in the summer? Dr. Maglonso?
Sore eyes is easily contagious. No, like if you hold on to something where there is the infection, the viral infection or the bacterial infection, because another person who had sore eyes hold into it, then you try to place your hands in your eyes, then they can easily get that. Or if you use a makeup which has been previously infected by another person who has sore eyes, then your eyes can also be affected.
Sometimes you don't know that this person has sore eyes. So how do you know for sure that it is sore eyes? What are the telltale signs?
There's redness, there could be itching, there could also be a watery type of discharge. This is usually for viral conjunctivitis. So you have to avoid scratching your eyes, because when you touch something else and somebody else touches that object, then that is how it is transmitted. So avoid scratching the eyes, and if that's why some people wear shades even when they're indoors, so that they can just to remind them that you shouldn't scratch your eyes because you have those shades. Or you can also put some cold compress over your eyes. But it's really quite bothersome for those who have sore eyes because of the itching, the redness, and there could be also associated pain. So they can also take pain relievers.
How long does sore eyes last?
It depends on whether it's viral or bacterial, no?
Okay, what's
Because
the
the
difference?
bacterial, usually they have complications already. Sometimes there you can see some pus in the eyes. But the viral one, the least is 5 to 7 days, but it can also extend.
They say when the sore eyes ends, like on the 5th day, yun yung pinaka nakakahawa. Is that true? Can you still get
No,
sore
it's
eyes
actually contagious all throughout.
from the 1st day to the 7th day?
It's through contaminated hands or anything that you touch and you place your hands on your eyes.
Okay, so the lesson learned is try to avoid scratching your eyes.
Yes.
And if you have
also
sore eyes, you stay
wash your
home.
hands.
Wash your hands
And
properly.
sharing personal items, especially that goes into the eyes, like towels.
Okay. Another viral infection, which is common during the summer, is chickenpox, which is also contagious. So please tell us about chickenpox and how does one know that they have chickenpox and this is not your ordinary pantal? Because, di ba, I've had chickenpox and I thought na it was just an insect bite and you scratch it and then it pops and then chickenpox is there. So how does that, how do we describe
the
chickenpox?
lesions, the skin lesions in chickenpox are papillovesicular. So parang siyang may tubig underneath. There's an elevated area. It usually starts from the face to the neck and then spreads to the trunk and to the extremities. Patients may also have prodromal symptoms like fever or body malaise. So they may feel some body aches associated before the appearance of those rashes. And because of this is also very contagious disease. So they should avoid or isolate themselves, no? Because they can also infect other people.
Why is it contagious? What about the chickenpox that makes it contagious?
One is the hygiene also through direct contamination, but indirect contact can be also if you are living in the same household, then anybody can also get that. So the preventive measure is really isolation.
Okay, and another preventive measure, vaccine? Is there a vaccination
Yes.
so that you don't get the chickenpox?
Yes,
Is that correct?
there's a vaccine, the varicella vaccine. So if you have the varicella vaccine, then you're protected against having chickenpox. But if you don't, and you're exposed to a patient with chickenpox, well, they say that within the first few days, you can still get the varicella vaccine, so that even if you develop chickenpox, it will be more of the milder type of chickenpox.
Why is it during the summer? Why is it more common during the summer?
Well, it's not really...
All year round ba?
All
Would
year
you say?
round.
Okay. Because I remember during the summer, parang towards the last few days of school, nagkakaroon na, the kids start having chickenpox and hawa-hawa already because, as you mentioned, they're in one area only, and then the virus is just around. So they get it during the start of the summer.
Maybe it's easier to spread during the summer because people go to crowded places. You don't really know who you are mingling with. Unlike, for example, when kids are in school, if there is a patient or a student with chickenpox, immediately they don't allow the kid to go to school. So
That's true. And not allowing the kid to go to school also when there's measles. What is it about measles that we have to know during the summer or all year round for that matter? Dr. Maglo.
So it's also not only during summer. no?
Okay.
So measles is a viral infection. Then it's just like chickenpox. However, the lesion is different. So if in chickenpox, the lesion is vesicular, yung parang may tubig sa loob. In measles, it's macular. Ibig sabihin mapula siya, parang redness, no? Which can occur in different parts of the body. Then there can also be some lesions in the mouth, yung tawag namin Koplik spots, in measles, plus the fever.
And the vaccine for
Meron
measles.
din.
Measles vaccine.
Before they turn 1 year old, I understand that the vaccine
9
must be
months.
administered 9 months and then repeated.
Booster at 15 months.
Doctors will talk about summertime and digestion when MedTalk returns.
There are many summer diseases that can pose a threat to you and your family if you're not careful. For instance, because of the hot temperature, food items tend to spoil faster, especially those that have been prepared in advance, such as for picnics and beach trips.
Usually due to vigorous physical activities outdoors during summer, and so we tend to have sunburns. So skin diseases, common din siya dahil madalas, tulad pag marami ng tao, madumi na yung tubig, especially in public beaches and in swimming pools which are not properly maintained.
Beaches, lakes, pools, and campsites can also be a source of harmful bacteria and viruses. Other summer diseases can also spread from person to person if you practice inadequate hand washing or if you tend to share utensils when eating in and outside of your home.
Iwasan din natin yung mga kumain ng mga street foods as food tends to spoil easily during hot temperature. Iwasan din natin yung ma-expose under the heat of the sun between 10 a.m. up to 2 p.m.
We're back here on MedTalk, still talking about summer diseases. You may join our discussion by calling our hotline at 548-4678. Doctor, summertime and digestion. Festive eating and drinking, a change in routine, you travel, and later on you find yourself with either diarrhea, constipation, worse, food poisoning. So let's first talk about diarrhea during the summer. How does this happen and why does this happen more frequently during summer?
Well, it's because most people get infected by eating contaminated food or also contaminated water. Like if they're not sure about who prepared and who cooked the food and how well the food is cooked, then they are putting themselves at risk for infections, either from a viral infection or a bacterial infection that can lead to diarrhea.
But how will we know that our food has bacteria or not prepared well when it's a fun time? You know, you're not conscious of those things. You just want to eat, enjoy the company of your friends, and enjoy the good food.
Usually, it's you will have already the symptoms. No? If you were able to eat food which is contaminated with the bacteria or something which has the toxin, then you will have diarrhea.
So diarrhea is described as, from my understanding, it's watery,
Watery stools.
pain in the
Increased frequency. So it's more frequent than your regular bowel movement, and it's watery. It can also be mucoid. Sometimes it can be bloody, depending on the organism that caused the diarrhea.
first aid for someone who is suffering from diarrhea. What should he or she do immediately?
Well, the patient should rehydrate, keep themselves hydrated. The problem is that if the patient is also vomiting, then it might be difficult for them to take oral rehydration. Or they can do, but in small quantities, more frequently, but small quantities. But if the diarrhea is more severe and very fast, then they might have to be put on IV fluids.
How many days should we monitor our diarrhea? Does it go away in a day upon drinking dehydration fluids, or does it go on the last, more than a day that we need medical attention already?
No, it's not the number of days, it's the symptoms that the patients have that they have to watch out for.
Okay.
So like if there is already sunken eyeballs, then increased thirst or very dry skin, then the patient is already lethargic and has fatigue, then they should go to the hospital so that IV fluids be given. So once in a while, they should be taught about these warning signs of dehydration.
So it's not the number of days, but the symptoms. I always thought it was the number of days. You count the number of days that you've already been dehydrated, or you're still going to the bathroom frequently. Now I know it's the symptoms of diarrhea. Flip side, constipation. When you travel, you're not able to eat well and right. Your routine changes. So how do we remedy constipation during the summer, Doctor?
So in the food that you eat, because you have to eat leafy vegetables, then cereals can help also, or fruits like papaya can help remedy constipation. Then drinking a lot of water, so at least 8 to 10 glasses of water a day.
Let's now go on, let's move on to food poisoning. A lot of picnics, a lot of outdoor activities. Again, you've mentioned that we don't know who prepares the food, but if you yourself prepare the food, then no fear that one might get food poisoning. But still, sometimes, there are cases that you still get it. So what do we do? How do we remedy food poisoning? First aid for someone who has food poisoning.
Well, food poisoning is quite common for certain types of food, like those food with sauces, gravies, also pastries. Commonly, they will cause staph infection that can lead to food poisoning. So try to avoid those easily perishable foods that may be dairy-based or cream-based, because that can cause more of the food poisoning. And then for the treatment, well, it's the same basically for any type of diarrhea. So you have to monitor the hydration of the patient. If the patient is vomiting coupled with the diarrhea, as mentioned by Dr. Maglon, so you have to monitor the signs of dehydration. And even the urine output is very important for patients with dehydration. So if there is no urine output, it means that your patient is really dehydrated. Or if the urine is very highly colored, then it means that the patient might also lack fluids. But aside from just water, you need to also replace the electrolytes. That's why you don't just replace it with just plain water. You replace it with an oral rehydration solution, which contains the different electrolytes like sodium, potassium. Or you can also initially maybe take some of the sports drinks, because they contain also electrolytes.
Doctors, we have a question from Twitter. Is gastroenteritis contagious? What can I do to avoid spreading the virus to my family members? What exactly is gastroenteritis, doctors?
Yeah, it's the infection that may be caused again by virus, bacteria, or even parasites. So it's just a general description of diseases that can cause diarrhea.
Is it contagious, as the question?
It is not
was
contagious
raised?
through direct contact. However, you have to, how they can avoid that, it's still the proper sanitation. So look at the food that you eat, then the water that you drink.
Okay,
And proper hand washing when you prepare the food, even the utensils that you use for preparing the food, because it's usually waterborne, or because of dirty hands, especially if you've just been to the restroom. So you have to practice strict hand washing before you prepare your food.
And most especially if you're eating raw fruits and vegetables.
Yeah, they should be
During the summer,
thoroughly
it
washed.
doesn't spoil easily as those dairy-based and cream-based. So
Yes.
that's what we normally take with us when we go on a picnic?
So with very high temperature, usually after 2 hours, the food can spoil. If you will be traveling for a long time, maybe you should have a mini refrigerator in your
or those
car
coolers.
or something to cool, or do not bring those type of food.
Okay. So it's advisable to bring
Just cook it at the site or buy there.
Perfect. Yeah, good idea. Doctors, how about heartburn, which has no relation to the heart? What exactly is a heartburn? How do you know if you're suffering from a heartburn already, Dr. Maglonzo?
Usually there's epigastric pain. It's in the middle side of the stomach.
Okay.
And the pain is burning, and it usually goes up to the chest. So that's heartburn. But they can have other manifestations also, like in severe cases, vomiting already.
What causes a heartburn?
Well, sometimes too much alcohol, like when you're having a good time at the beach. Or you're eating too much spicy food and different types of food that can also increase your acid.
First aid for someone suffering from a heartburn.
Well, they have to really consult a doctor so that they can be given the proper medication. I wouldn't want to say the medications.
Okay.
Because they might self-medicate. But, well, usually over the counter, they can buy Malox, those different brands of antacids, where initially they can use that maybe to neutralize the acid. But if it becomes worse or progresses, then they really have to see a doctor.
Okay. Can heartburn lead to other types of health conditions, or does it stay a heartburn? It doesn't lead to anything else?
Well, it could also lead to more problems like esophagitis. So instead of just being localized in the stomach, it can also irritate the upper gastrointestinal tract. So you can have more problems for those patients.
Doctors, we now have a question again from Twitter. I was sick after eating quack quack. How do I know if it was what it was made of, or what made me sick? Quack quack is
It's a street food.
Okay, yes. That's the orange one. Is that correct?
Yeah.
Yes, that's the egg.
That's coated with something.
Like orange egg. It's like breaded, right?
Yeah.
Yes, I see that a lot. And made our follower on Twitter sick. So what is it about quack quack?
It's not the kwek-kwek, no, but
Okay.
it's how the kwek-kwek was prepared. We know that it's a street food, it's exposed to a lot of dust and other bacteria out there. Then, of course, the food handler who made that also, if the hands were properly washed. So, we don't know the symptoms because he just said what made him sick.
Yes.
But usually, the symptoms that they will have is diarrhea also, because gastroenteritis can happen if the food is not properly prepared. Then the other one is the other types of gastrointestinal infections, like you can also have typhoid fever, you can also have hepatitis A. So it depends on the symptoms that the patient have.
Maybe he also ate something else
Oh, yeah, we do
prior
not
to
know.
the quack quack. So, or the street food for that matter. We were talking about eating street food earlier, and as much as possible, try to avoid. But if you can't, what medical advice can you give our viewers who enjoy that type of food, or who would like to try that type of food?
Make sure that the food they're buying is well cooked, that it's thoroughly cooked, because sometimes if they're not thoroughly cooked, especially mga inihaw-ihaw, no, sometimes they're not thoroughly cooked, so they're more prone to gastrointestinal diseases for those types of food.
Summer also brings about motion sickness, especially when you have long car rides. So what is the remedy for motion sickness? What's the first, what should we have in our bag, like I asked earlier? What's the first aid? What first aid remedy should we have?
Or there's some medicines that you can take before you go on a travel. Usually take it 2 hours before you travel, so especially if you're going on a flight, to avoid motion sickness. But if you don't have those medicines on hand, then and you feel like nauseated or vomiting, then you can just eat some ice chips in the meantime.
How about smelling fragrant, like those small little,
What do you call that?
yes, the things that you can smell so that it will alleviate your motion sickness. Is that okay?
Yeah, it can relieve also. But the medicines are important.
Okay.
You should take that. So that is another thing that you have to bring.
Okay, so now we have three. We have the towel, we have the allergy medicines, and more medicines for motion sickness. Any other illness or health condition that we must watch out for during the summer?
What else?
They say acne, but it's
Acne,
not really
yes.
only during summer, no. But because acne has several causes, like some can be genetics, the others will be depending on the hygiene of the person. But there's a lot which occur also in summer because it's very hot and sometimes the pores are being clogged. So one can be prone to acne also.
And during the summer, you'd want to wear lesser clothing. So you'd want your skin free of any acne or
Yes.
acne. Any remedy for that?
If you have the acne already,
Yes.
there are topical medications that can be applied, but they should not self-medicate because some of these medications contain steroids, and steroids can have some adverse effects on the person also if not properly applied.
Okay. Doctors, will talk more about our health during the summer when MedTalk returns.
Did you know that it takes roughly 8.3 minutes for sunlight to reach the Earth? When you look at the sun, you're actually viewing what it looked like 8.3 minutes ago, since it takes that amount of time for sunlight to travel to our planet.
We're back here on MedTalk, still talking about summer diseases. Doctors, we now have a caller on the line, Generosa. Good evening, Generosa.
Good evening po.
Hi, good evening. Yung question mo for our doctors.
Tatanong ko lang po kung, kasi ngayon pong summer, kadalasan po sumasakit ang ulo ko. Tapos parang naduduwal po ako sa sobrang sakit ng ulo ko, sa sobrang init. Ano po kailangan kong gawin kung ma-atake po yung migraine ko?
Salamat, Generosa. Doctors?
So, ang nararamdaman niya ay yung pananakit ng ulo, pero maraming possibility kung ano tong pananakit ng ulo niya. Ang isa ay migraine, yung isa naman yung tinatawag natin na muscle contraction headache or tension headache, or baka dahil rin sa mata, maraming possible causes, no? Pero kung gusto niya talagang malaman yung cause, syempre pupunta siya sa doktor. Pero sa bahay, pwede naman siyang magkaroon ng mga pain reliever na pwede niyang inumin. And then, kung dahil sa init, palagay niya, pwede rin siya maglagay ng ice pack. Yun yung mga home remedies na pwedeng gawin.
Generosa?
Opo.
Andyan ka pa? May question ka pa para sa mga doktor natin?
Tatanong ko lang kasi yung pati yung sikmura mo para kang naduduwal sa sobrang sakit ng ulo ko. Ano po yung dapat kong gawin? Kasi hindi po siya matanggal. Sumasabay sa sakit ng ulo ko. Kasi migraine po kasi yung sabi ng kasi nagpa-check up po ako.
So, kung migraine talaga siya, dapat may iinuming gamot para dun sa migraine. Kasi isa rin sa simptoma ng migraine yung parang naduduwal o yung iba nga nagsusuka talaga.
Generosa?
Opo.
Okay na?
Okay na po.
Okay na. Sige, ingat.
Sige po, salamat.
Salamat din.
Usually, migraine medications are taken even before the actual attack, where you have you have a feeling that's gonna come soon. That's why you take the migraine medications before the actual headache before the actual headache comes.
And maybe she's feeling the heat a lot more sensitive than those who do not have migraine. So, pag mainit talaga,
Isa rin yung sa trigger
head
ng
and your
migraine.
stomach. Trigger rin ang migraine. Okay. So, take her medications and observe, no? As a patient rin, as an individual, you also have to observe changes in your body when the season changes, and you have to adapt, and you have to address each and every medical concern pag nangyari na, di ba? And prevention is always key, like we say here on the show. So, in preventing all these health concerns during the summer, would you have any tips on how to stay healthy and disease-free during the summer, Dr. Cruz?
Well, if you plan to go on a trip, you have to plan it well. You have to keep in mind that for your family to enjoy your trip, you have to make sure that you do not also compromise the health. Like, make sure the food that you prepare is well-prepared food, home-prepared food. Make sure that you store them at the proper temperature if they need to be stored in an ice chest. Also to make sure that they bring emergency medicines. So, like we were talking earlier, parang a small first aid kit should also be brought during the trip. Make sure they have also a lot of water, especially clean drinking water, because you never know if the place that you're going to will have clean water. Or even if you make stops in between, you don't know if you can get safe water, safe drinking water.
Thank you, Dr. Cruz. Dr. Maglonzo?
Cleanliness is very important. So make sure that the facilities that you're going into is clean, and then that they also have appropriate facilities, like in case there will be emergencies, do they have immediate first aid measures, like do they have a nurse or a doctor in the resort who can help them out. Then of course have a checklist for the different medications that you need to bring.
That's the role of a parent.
Yes.
A checklist of different medications that you have to bring for your entire family. So again, we started by asking you doctors what would be in that checklist. We'll end by reminding everyone what should be in that checklist.
Medications for fever, for allergy, for GI
sickness.
upset. What else?
Motion sickness,
Motion
so you
sickness.
have to bring that. No, for cough and colds, so those simple things. Heartburn, lahat ng diniscuss natin. Dapat meron sila para doon.
Okay, and the number of your doctors, of course.
Yes.
Because
On your,
it's very important on your speed
emergency
dial, on your emergency dial, yes. As a parent, your role is to make sure you have fun and that your family is well taken care of and are healthy, hopefully free from all these types of
and don't forget
skin
the sun
problems.
protection.
Yes, the sun protection. For kids and adults, quickly before we end the show, for kids, how often should we apply sun protection? What is the best number, SPF number for our children?
Actually, it's the same
the
for
same.
adults and children. You can apply the same SPF, not lower than 15, like I said earlier, and reapply it every 2 hours, especially if you went swimming and then you towel off. So you need to reapply your sunscreen.
Okay.
For younger children,
Yes.
make sure that it's the parents who apply, because sometimes the children place their hands in their mouth, and then the sun protection is placed in the mouth also.
So their mouths also
So there
protected
can be
from the sun.
poisoning.
Okay. So thank you very much, doctors, for helping us understand all these health concerns that we may come across during the summer. Thank you very much, Dr. Maglonzo and Dr. Cruz. We'll see you again next Tuesday, 7 p.m. on your scheduled on-air consultation here on the Solar News Channel. This is Angel Jacob. Enjoy the summer, everyone. Good night.
Acute inflammatory reaction due to exposure to the sun. But people can also get sunburn like although in the Philippines we don't have tanning salons, so it's mostly due to direct effect of the sunlight. So this can cause erythema, this can cause redness of the skin. Sometimes there is also associated itching. So we need to really protect our body against sunburn, because it also depends on the UV light, UV radiation. There are 3 types, the A, B, and the C. So the A and B are the most harmful to our skin because they are the ones that penetrate the atmosphere, while the UVC is filtered by the ozone layer. So that's why you would see that in sunblocks or sun protection lotions, this usually refers to UVA and UVB protection.
And we talk about the protection, we talk about the sun. Do you think, in your medical expertise, the summer here in the Philippines every year, it gets hotter, it gets more humid, it gets drier? What do you think of this, Dr.
Yes,
Maglonzo?
it changes because of the climate change. Originally, summer is usually April, but March, sometimes there's already hot weather. When the Holy Week starts,
Yes.
usually it feels hot.
Yes.
So those are some of the changes. But unfortunately also, there were also some rain during that season. So the change in weather, like it will rain, then it will become hot. So that will cause some of the different summer diseases also.
And going back to sunburn, you mentioned what it looks like and the feeling, or that one is already sunburned. Because sometimes hindi mo na napapansin that you're already burned by the sun because you enjoy the sun that much and you want to achieve a certain color. But little do you know, nasusunog ka na pala ng araw. So
yes, it doesn't appear. The redness doesn't appear right away, usually after 2 to 4 hours. So if you are sunbathing, then you don't notice the effects. But when you get out of the sun, 2 to 4 hours, then that's the time you see the erythema. And it could be a little painful also because of the burn of the skin. So you really have to stay away from the sun, get as much protection, wear the proper clothing to protect you against sun exposure.
And what's first aid? What is your first aid? Let's say you're out at the beach, you're traveling somewhere, and you have no access to go to your doctor. What is the first aid remedy that you can do for sunburn? Dr.
You can
Maglonzo?
place cooling ointments like zinc oxide. It's easily available in drugstores. Then, of course, you have to drink so that you prevent the complications.
How about a cucumber? Just cooling, something cooling. I
Yeah,
mean,
it
which is readily accessible if you're at the beach and you
It
have
has
no...
cooling effect, but as far as these things are concerned, we don't have scientific studies.
Okay, so when it comes to sunburn, prevention, wear your SPF. If you do get a burn, then and address it just as Dr. Maglonzo has mentioned. Now we move on to
Ports, beaches, and other public places.
Para doon sa mga madalas na mag-out of town during summer, so dapat maging handa tayo sa mga dadalhin natin. Magdala ng sunblock na ilalagay 30 minutes before lumabas to do your outdoor activities. Drink lots of fluids.
If you're not careful, you might easily get infected with colds and cough because of the erratic weather patterns. How can you better protect yourself against these summer diseases? What are some possible home remedies? All these and more tonight on MedTalk.
Joining us tonight is Dr. Maria Victoria Pilares-Cruz, a national board member of the Philippine Academy of Family Physicians and a family medicine specialist from the University of Santo Tomas Hospital. Also with us is Dr. Eva Irene Maglonzo, the Executive Secretary of the Philippine Academy of Family Physicians and a medical specialist from the Philippine General Hospital and the University of Santo Tomas Hospital. You may join our discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening.
Summer is here and the heat is on. It's so hot these days.
Yeah.
And just like the BTR said, it brings about skin problems,
Yes.
digestive problems, and different types of virus that we can get during the summer. But first, let's talk about summer skin problems, the most common summer skin problems. Let's start off with sunburn. So please tell us what exactly is sunburn.
Well,
Dr.
it's
Cruz.
an acute.
This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
It's the onset of the summer season. Most people are gearing towards lots of outdoor activities with family members and friends. But along with the excitement and the fun come the dangers and risks involved in the warmest time of the year. The main culprit would have to be excessive exposure to the sun.
Some of the common summer diseases are sunburns, skin problems, stomach ailments such as diarrhea, sore eyes, dog bites, and flu. Usually mostly due to the hot, humid weather during summer.
Too much sun exposure can lead to heat exhaustion and cramps and heat stroke. Another hazard is direct contact with more people in air.
AB and UVC. Is there a particular time of day that we need our sun protection the most? And there are times during the day, even when we're under the sun, that we can skip sun protection? Is that correct?
Well, they say that you need to really avoid the sun between 10 a.m. and 4 p.m. But if you need to really go out into the sun during that time, then you have to wear sun protection. It's quite fortunate for us Filipinos, since we are medium to dark skin, that we have already a lot of melanin to protect us from the from immediate sunburn. No? But for those who are fair skin, they easily sunburn. But for those who are darker skin, they easily tan naman. So it's more advisable that you use a higher protection for those who are fair skin, like SPF 30 and above, while if you have a more medium or darker skin, you can use at least not less than an SPF 15.
So SPF 30 and above for fair-skinned and 15 for those who are already naturally tanned, so to speak. How often should we apply our sunblock?
So you should apply 30 minutes before going out or before exposure to the sun. Then you have to reapply, because the others, they just do it once. You should reapply every 2 hours.
So if you do it once, you're more prone to sunburn? Is that correct?
Yes, you can still get the sunburn if you don't reapply.
And the sunburn, a quick description of